Good morning, everyone. Today we have with us one of the eminent doctors from Dhanbad, Dr. Gaurav Prakash. Dr. Gaurav Prakash was earlier associated with prestigious KGMU, SGPI, and RML Hospital, Lucknow. Currently, Dr. Gaurav is practicing in Park Clinic, Dhanbad, and is also a visiting consultant in Asian Dwarkadas Jalan Super Speciality Hospital, Dhanbad. Dr. Gaurav Prakash has rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, sir, on the Forbes platform. So today we will be having a discussion with Dr. Gaurav Prakash on the topic of overactive bladder. So, sir, as a problem with bladder function that causes the sudden need to urinate, that's what we all say is overactive bladder. So can you please tell us something more about this condition?
Yeah, of course. By definition, that we have been listening to and we have been by academically, we know that it is actually the urgency, which is the most important complaint what patient actually comes for. That is urgency. It could be with or without urgency incontinence. That is, if they can get wet during before voiding, and then it is associated with or many a times not associated with frequency, that is to go to the voiding for so many times, and then it could be nighttime frequency, that is nocturia. So these all symptoms get together to then it forms actually what we call overactive bladder.
So sir, what are the major symptoms that the patient usually experiences?
He or she actually tells us that he cannot or she cannot postpone voiding. That is the most important symptom. And then the frequency of voiding, that he or she used to go to toilet so many times. And the third thing is that during voiding or before voiding or before even start to void, they can get wet. And the fourth thing is that many a times they have to wake up at night. These are the complaints of overactive bladder.
So are there any particular individuals who are more prone to develop this condition?
Usually it happens when you ages, when you, at the extreme of age it happens. And then there are certain few conditions like if a patient suffers from recurrent urinary tract infection, the bladder adjusts in that way that overactive bladder happens.
So what are the various treatment options available?
There are so many treatment options, but before going to treatment, we ask patient to just first we take a very good history, because history and examination part is most important thing while diagnosing this and going to the treatment plan, because the medications available for overactive bladder are not as such that they can going to cure everybody. So we have to know the severity of the symptoms before starting treatment, and before even going for medications we ask patient for certain things like lifestyle modification, like restricting water intake, timed voiding, like you don't have to once you feel the urge, you don't have to postpone your voiding, because you have to go to void. And then there are certain other things like maintain your hygiene, and then to avoid certain products like tea, coffee, if you are taking alcohol, if you are using cigarettes, like smoking if you are doing. So there are things we usually try to modify. These are called lifestyle modifications.
Lifestyle measures.
Yeah, then we try the patient to undergo certain kind of exercises. These are called pelvic floor muscle therapy. We ask the patient to do those things. And then after that, if patients are not as such getting treated by these things or well managed by these things, then definitely we are going for medications.
So sir, what are the different medications available?
There depends upon, actually there are certain investigation we used to we prefer before starting medications, like we go for an ultrasound, we try to know the uroflowmetry test, if because these overactive bladder symptoms many times are associated with bladder outlet obstructions, means patients are even not able to void properly. So we have to rule out certain things like UTI, like stones. So we have to first rule out things. And if we are reaching to diagnosis that yes, it is overactive bladder, then we start with some anticholinergic drugs. And then there are certain beta-3 agonists available, like mirabagrons are available there. It can be started with alpha blockers, or we can give it without alpha blockers. So depends upon the symptom scenario, what are in patients, and if they are male patients, female patients, there are certain things on which we decide.
So, sir, do we tell the patients to have fluid restriction also? To
Of
restrict
course,
their
of course,
fluids?
of course, because that is most important thing. Many times patients are very much comfortable while voiding day, but at the night time they are they are very disturbing, because you have to wake up in night, and that is going to disturb your sleep. So we have to ask patient the evening time. You don't take tea, coffee, or you have to, if they are taking milk. So these all can kind of things are getting calculated into the volume, and these all are going to convert into urination. So we have to take these into consideration. So of course, after evening time, we usually use to stay the patient to restrict the volume of taking water, volume of taking milk. These all going to construct the whole amount of urine in night. So of course, fluid restriction is there.
Exactly. So that's what my next question was, sir, that it's difficult for the patients to sleep, overactive bladder patients. So any specific measures for them?
Yeah, first thing is
Fluid restriction is one of them, but anything else that needs to be done?
of course, why not? The first thing is that if a patient is, we have to actually measure the volume. Depends upon the volume what they are going to void. Let's say if it is less than 50 or less than 100 ml of volume they are going to void, then we have to start medications. We cannot just go for just lifestyle modifications. But yes, if they are, if, these patients are voiding 200, 250 ml of urine, we start doing some frequency volume charting, and after that we start medication. So lifestyle modification always there. Then we have to ask patient to take dinner early so that they can go to sleep, and then you have to sleep, because patients actually go to the bed starting watching TV and talking to each other. So they are saying that they are going to sleep, but they are not, actually not sleeping. So they are actually disturbing their whole routine. So we have to ask, these are the lifestyle modifications, and then the medications too.
So, sir, I think we've had a very healthy and fruitful discussion, and I'm sure the audience would have really benefited from today's interview. And I really thank you for sparing your valuable time and coming and educating us on this topic. And have a great day ahead, sir. Thank you so much once again.
Thank you
Thank
very
you,
much,
sir.
folks. Thank you very much for giving me an opportunity, and I'm really very grateful to it. Thank you.